on the treatment strategies after the failure of the conservative treatment of adenomyosis. So the status and our goal is to relieve pain and to reduce bleeding and promote the fertility. So now we have many solutions, the different drugs, COC, GnRHA, and uterine sparing surgery, and HIFU, and the other drugs. And also some HIFU treatment and embolization. So we have various treatment with very limited efficacy. So when we stop the drug use, there will be the recurrence, and because of the removal of the marina, the recurrence may happen again. So embolization, UAE, HIFU may also recur. So easy to cut or remove the uterus, but preserve the uterus is difficult. So adenomyosis is chronic and requires a long-term management. And adenomyosis urgently requires this consideration. So I have a series of the cases, some failure of these cases. So I would like to share you with these cases. So 43 years old, the marina was removed or dropped off half a year later. So we did this ablation surgery, and within 5 years, it is well under control. 3 injections of GnHA, and the 5 years, the 5th year. So that's the first case in our hospital. So I suggest MRI, and we can see some small lesions, and also suggest a Mirena because she is 49 years old, and she feels reluctant to have Mirena. And now, so far, it has been 6 years and normal menstruation flow. And so the detachment of the Mirena, HIFU plus GnHA and Mirena, and the outcome is satisfactory. So the second case is about the failure of the Mirena and the others. So the detachment after 3 years of the placement of the Mirena, and this patient come to our hospital center for treatment. So we offer her the HIFU plus GnHA and Mirena. Follow-up visit 5 years, and with good outcome of the treatment. So the failure of Mirena with HIFU plus Mirena and GnRH. And this case is in 2008. Light anemia and dysmenorrhea. So I suggest no surgery for this patient, but we suggest a HIFU treatment. So this, as you may see, irregular contour of the uterus of this uterine, and some damage of the surface of the uterine. And after the treatment of HIFU, we can see that the outcome is satisfactory, and the relief is her dysmenorrhea symptom. So HIFU plus Mirena plus GnRH. So in 2021, we published the paper. It's about the clinical evaluation of this solution. So 36 with failure of Mirena, and 7 cases of GnRH and Mirena failed. As you may see from this slides, and we offer the HIFU plus GnRH, 3 injects and Mirena. So the relief rate of these patients after the operation has been improved, and menorrhea and dysmenorrhea also has been well under control. And in 28th, 2 cases of detachment of the Mirena, and 24 months, 3 cases of the detachment of Mirena. So one case required repeated HIFU treatment after the detachment of the Mirena. And after this time, the repeated HIFU technology and the treatment, the patient feel good. So in-time management and the repeated HIFU treatment offer the patients good outcome. And we may consider the HIFU comprehensive treatment after the medication failure and recurrence. What about the recurrence and what we will do after the recurrence happen? So we have to analyze these patients whenever these things happen. So in 2018, HIFU treatment plus 3 injections GnRH, but with a car accident. So the detachment of the Mirena happened due to this accident. And the removal or the displacement of Mirena. So she resorted to HIFU treatment in our hospital. And this is the ablation effect after the first treatment. And after the repeated ablation therapy, as you can see this one, the first one and the second one with even more extensive range of the ablation with better outcome in the second time. So the recent 3 years, no report of menorrhagia and dysmenorrhea. So HIFU comprehensive treatment is considerable. And also digest failure and recurrence of the adenomyosis. So before digest was used in China, so she resorted to this treatment in Hong Kong. And after that, the failure of the digest, we offer her the HIFU comprehensive treatment with satisfactory outcome, no dysmenorrhea and menorrhagia within 3 years. And 3 years later, there's a little bit recurrence. So in 3 years and a half, we have this MRI, and the volume of this return is the same as it was, but with very good symptom of menstruation flow without any recurrence. So we communicate with the patients for repeated HIFU or digest treatment. So we choose the digest, then there is no menorrhagia or dysmenorrhea. And 5 years after that, and the patient decided to have the repeated HIFU treatment again. So in this year, May, she had a repeated HIFU treatment. As you can see from this video, the slides shows very good results of this treatment. So for these patients, we recommend the HIFU plus GnRG and LNGIUS. Through the communication, we can add some more digest or HIFU treatment. And the last case is a big challenge for us. So 2 years after the detachment of the Mirena, so after the treatment, very satisfactory, feel very comfortable over the 2 years. But one suddenly, the detachment of the Mirena happened, and with menorrhagia and dysmenorrhea. So the patient felt reluctant to wait. So we had this pre-operation evaluation on this patient through this MRI image, as you can see. So we feel not so satisfactory after the second time ablation. So just 2 years after the first ablation, it recurred. So repeated HIFU treatment. So we had a communication, and so we didn't see a very quite a satisfactory therapy result. And after that, we can see that 38 months after this treatment, we see a rather satisfactory result. Although it is not that desirable, but it effectively cures the disease in recovery and reduce the pain of the patients. So in this way, we can see that the repeated HIFU technology can complement the other shortcomings of this treatment. So also I do some reflections on this case. This case is very challenging and difficult, and I cut part of the lesion. The drug treatment failure or recurrence after conservative surgery and recurrence after the comprehensive treatment of HIFU may lead to the total hysterectomy. That is the traditional way of the choice. Maybe you may say another HIFU treatment. So for our patients, we hope that we can use this method to preserve the uteri. So HIFU-based comprehensive treatment can maximize efficacy and minimize injury through micro-non-invasive treatment. And after the conservative treatment of adenomyosis, HIFU comprehensive treatment can effectively control the clinical symptoms. And this treatment can be repeated and to control the clinical symptoms and reduce the hysterectomy rate. And so the strategy for our patients is that we should have this patient and technology and the perseverance to wait for the right occasion for the best solution.